Okay, real quick, we're going to do a couple things because we want to make sure that everybody understands that this is a special presentation that's brought to us by Retirement Services. So we like to make sure that they have a nice, enjoyable time here. So please, if you have a problem with what you think are the choices are for healthcare, keep them to yourself because this lady's here just to present the information. And I say that facetiously, but there's going to be room for questions and answers afterwards. A second thing that comes up, all those people that are on Medicare should have received one of these in the mail. I don't know how many of you throw it away or how many of you keep it, but you ought to keep this because this answers a lot of questions about Medicare. It gives you numbers to call. It explains what your benefits are according to Medicare, not according to our health plan, but according to Medicare. It's an important book. Ray and I use it all the time because we don't have all the answers in our head. So if you get this, keep it, and you can reference a lot of stuff yourself, okay? That's really, really important for you to take care of taking care of yourself like that. The other thing that I know we're going to discuss is that for those of you on Anthem, because we have two sides of the house here today. We have Kaiser and we have Anthem. Hi, Teresa. I'm stalling. You're doing good.
You made it.
So we have two sides of the house here. On the Anthem side, I know that a number of you received a letter from Anthem that talks to you about the fact that there's two different plans basically for Medicare. One is cheaper than the other. The cheaper one requires that you pay a $75 copay if you go to the emergency room. The more expensive one doesn't. Teresa's going to talk about that because I know there was some real problems about, well, what about the rest of the benefits? Is it different? So Teresa has that in her mind. I've talked about it. So to keep that there. So keep the questions to the end. And I think we should go along pretty good on that. So, okay. The other thing is I'll be out here with a microphone. So if you have a question at the end, I'll just be mimicking the question on the PA system so that it goes through to the people here on Zoom, okay? Or if you want, you can stand up, come talk on the microphone yourself. But that's what we're going to do, okay? Teresa.
Thank you. Silence. There we go. I don't really need applause, but thank you. Thank you for bearing with the transition time. Hopefully you guys were getting a bunch of fun information before I got here. But for some reason, both of our retiree associations like to have their meetings on the same day at the same time. So here I am. Let's move along. Open enrollment for 2026. As mentioned, I am Teresa Meyer-Calvert. I am the senior analyst over the health team with the Office of Retirement Services. And I'm here today to go through all of your open enrollment options, elections, timeframe, etc. Now, am I advancing my screens here? I do have control. Awesome. Okay, I'm going along. Maybe, let's see. Here. Ta-da, there we go, perfect. Okay, so I think this was the right slide. Yeah, my objectives, there we go. Sorry, I'm getting my brain into being here. I just raced across town on, what'd they put me on, 3 freeways? Okay, anyway, open enrollment. There are no changes we're going to go through today. The carriers that we have for 2026, any plan changes that we have, we do have some minor and some major, as Jim's already kind of keyed me up here. And then we have, I'll go through our rate changes, our Medicare requirements, some wellness options that you have available, and some additional resources available to our members. So open enrollment every year for our retirees runs the entire month of November. So that's the 1st through the 30th. We start accepting forms on the 30th, and you must have them in by the 30th in order to have changes that take effect on January 1st. Your packets should be arriving the last week of October. We are targeting to have them in hand to everyone by November 1st. For those of you that get electronic mail like our newsletters and you don't typically receive something by mail, you should be receiving those letters and forms in an email format. Check your spam filter if you haven't seen it within the next couple of weeks, because that's when I'm running my letters. It literally tags you at the same time. So you get them a little faster than the people who get the mailers. If you don't see anything in your inbox that you were expecting to, because that's the way you received it last year, look in your spam filter. Something may have changed with your mail carrier, but typically our stuff lands in an inbox. If you don't have anything in hand or electronically by November 7th, reach out to Retirement Services, ask for a member of the health team, and we will regenerate whatever it is that you need, and of course, answer any questions that you may have when you call. For those of you who have not attended our health fair, we hold a health fair at Leninger Center on November 5th. It's from 10 a.m. until 2 p.m. All of our carriers are there, so you can come in and talk to Kaiser or Anthem. You can ask Delta questions about your dental care. VSP will be there. We do have a plan change for VSP that I'll be bringing up in a little bit. We also have on site various wellness vendors. So last year we had stretch labs there that were helping members kind of, retweak and get their bodies working again. We had some massage tables. We had someone there that was helping with sleep apnea options. So we're going to have a combination again of our carriers and some wellness vendors that are going to be there to share their products and services and some activities for you on site. We have our annual bake sale that we hold during that time frame too. So we of course like you to come and support, get a snack while you're there. And I'll mention a little more on the health fair in just a couple slides. So open enrollment again is your opportunity, and I apologize if I'm going fast. I will slow down. I know I talk fast. Open enrollment is your opportunity to make changes to your enrollment options. So if you don't want to make any changes, you're good. You don't have to do anything. But if you do want to change either your medical, dental, or vision elections, either removing or adding dependents on, now is that time that you'll be able to make those changes. Noting here our health and lieu program. So for those of you who are not enrolled in our medical because you're getting medical elsewhere and you're banking these credits in our in lieu program, it's a gentle reminder every year that it is not a dollar valued program. It is a credit program, and those credits can only be applied towards your premiums. The one caveat of that is you have to re-enroll every year. So if you're in our in lieu program for 25 and you want to remain in 26, please fill out a form, submit it, because we really would hate for you to lose those credits because we do not retroactively credit them back. So if you've lost an opportunity, you have to have, you can pick it up the next year, but we don't retro it back, and you have to have a qualifying life event for us to add you on. So that's moving and having dependents and things like that. But again, if there's any questions about that program, please do reach out to a member of my team. We'd be happy to get a little more in depth because I know it doesn't affect everybody. Again, you can add or remove dependents, which if you have adult children, they roll off your plan at 26 for health benefits for the medical side of the house. And also for those of you who have Delta HMO, which is the Delta Care product, the lesser expensive dental product, they are able to stay on that plan until age 26. But anyone that's on the PPO plan or on VSP for vision, they roll off at 24. So any of you that still have adult children, kind of take a mental note of that. We will automatically be doing those changes so you don't have to. But if you have someone that's currently 22 or 23 that you want to add on, now's the opportunity to do that. All right. You can enroll on Member Direct. If you do your Member Direct enrollment, you save yourself postage because you don't have to mail the forms back to us. Just kind of a little tip there. We do appreciate anyone that enrolls on Member Direct because your enrollment information gets to us automatically. Like literally you hit submit and it sends us an email. So it's the easiest way for us to interpret the forms because we're not deciphering handwriting. And the other thing is we get everything nice and clear so that we can enter them in the systems. And lastly on this, of course, all changes again are effective January 1st. All right, so I gave a little teaser on the health fair before I hit the flyer. Part of the packet information that you'll be receiving if you get a mailer for us with your open enrollment packet, we'll also have this flyer so you can put it up on your fridge so you remember. November 5th from 10 to 2, we're going to be at Leninger Center, whole bunch of people there. It's a lot of fun to walk around. It gets a little busy, I do admit that. We also will have a food truck there, so if you want to visit us all day, you can kind of get your food, go out to the back patio on Leninger, sit there with friends, chat, revisit and things like that. Or you can get the snacks from our ORS bake sale. We, of course, appreciate the support. We don't, as you know, can't spend city money on any activities. So our holiday parties and things like that are all supported through our bake sales. So please come out and support us. All right, moving right along. I mentioned a little bit about Member Direct. For those of you who have not yet set up a Member Direct account, there's still time. As you can see, I don't know if the mouse transpires up or goes up there, but I'm going to kind of do a little circle around this brown button here. That brown button, that is on the top, the top right-hand side of our website. That's how you access all of your retirement information, like, you know, what is your pension check, how are your health insurance deductions going, and all that kind of fun stuff. So you can also submit your open enrollment elections beginning November 1st through the Member Direct portal. If you haven't logged in a little bit, that white splash screen that you see in front of you here is new because we did a system update. So if you don't see this and you're still having difficulty logging in, even though you think you knew what you did, because it may force you to update your password, hint, hint, please reach out to our office. We are there to help you during regular business hours. The front desk staff is fantastic at stepping you through the portal and making sure that you have access to your information. All right, moving right along. There are no new carriers being offered this year, so we still have Anthem and Kaiser for our medical coverage, Delta for our dental, and VSP for our vision. We do have a few key plan changes. Last year, you may have remember me mentioning this Maintaining Medical Plan Options Committee that we put together. This committee replaced what we used to do as a benefits review forum, and it's essentially members of this association, our SJREA members, different retired or different union representatives. So it's a combination of an effort between HR and retirement services and all of our associations, unions and retirees, coming together to study everything that went into our renewals this year. So they continued to meet monthly this last year. Everyone that was assigned and wanted to participate was able to participate and give feedback. The feedback that they gave was instrumental on where we are today, and we kind of got teed off with kicked off with the Anthem changes that we have and the letters that went out. This committee was instrumental in offering solutions because we all kind of came together, looked at the problem, and tried to come up with a plan to solve it. And I'll go into that a little bit detail later, but I'm just bringing up the committee because you do have a voice. You have a voice, and you're going to continue to have a voice as we transition this into a team that's going to support the upcoming medical RFQ that I will be working with our HR partners to make sure that we look at all options available to try and bring healthcare costs down. I know if you listen to the news right now, healthcare costs are definitely top of mind because they're headline news pretty much every single day. The good news is our rates were locked in before all of this chaos erupted. So our rates for 26 are not going to change, but we're going to do our best through this RFQ and all of these efforts to continue to have rates at a reasonable level, hopefully, fingers crossed, for 27 and moving onward. So again, this committee is very much instrumental, and if you want to participate in this, you'll hopefully find out more about this through your membership, but you have someone here that has been instrumental in attending all of these meetings with me. So Jim's got quite a bit of information on these things, which he's able to share, obviously, with you at the front end of this meeting. Okay, moving along. The two medical changes that we have, for those of you who are on the Anthem Medicare product right now, the PPO, you should have received a letter from my office letting you know that we are introducing a new plan. It also showed you what the rates were. So this isn't new news, but it's still shocking news. I mean, I'm still trying to absorb the increases as well. I'm going to go a little more detail on a different slide for this plan, but I'm just letting you know right now that this is a new plan that Jim was talking about at the head of the meeting. And then the other changes that we have for those of you that are not on a Medicare plan and are in the high deductible HMO with Kaiser, IRS minimum deductions were raised this year. So now it's at $3,400 for family and $1,700 for individuals. This plan is the lowest cost plan that's offered to our active employees, extended to us. And these plans are the ones that we benchmark our subsidy for all of our other plans. I know that that gets a little confusing, but it'll make sense when I have another slide as I'm trying to describe what happened with our Anthem rates. So bear with me for a minute. Just know that you have to pay out of pocket if you are on those high deductible plans, $1,700 if it's an individual and $3,400 if it's a family. Another key plan change this year is to our vision coverage. Our vision coverage, we had signature and choice. And whenever anybody comes in and they're looking at these plans, they're like, what's the difference between the two of them other than a couple of dollars? One had frames every 24 months, one had frames every 12 months. Okay, I could see that's a difference. Your lenses change every year, so they let you change those. But there were just minimal changes between the two and not a whole lot of dollars between them either. And so literally our membership between everyone that's retired in the city is kind of split 50-50. So what we did is we looked at both of these plans and what can we do to make it easier for everybody, not to have to try and figure out what the differences are, but for us to administer it as well. Selfishly, it's easier to administer one plan than two. So we took the benefits of both plans, put it into our choice plan, and enhance the choice plan by adding what you see up here on the screen as the Light Care. Light Care adds the ability to do a non-prescription sunglass. So if you want to add sunglasses, because you don't need to replace your reading glasses or whatever your prescription glasses are, but a non-prescription sunglass or a blue light filter. So for those of us that are on computers or on your iPhone all day, your eyes get a little tired. So the blue light filter does try to help filter out the spectrum of light that's affecting your vision. So it's an enhancement to your eyes to make them less tired as you're using screens all the time. So again, the changes are going to be for this upcoming year is anyone that's on a signature plan today will automatically roll to the choice plan. You don't have to do anything. I will be doing that in our system, so don't worry about that piece. But you will get frames and lenses every year. You will have this Light Care, no additional cost because it's built into the choice plan itself. And then the big thing also is polycarbonate lenses. Traditionally, VSP has only allowed those for children at no cost. Now they're extending them to adults as well through this enhancement. So you will have no additional copay to add that polycarbonate, which makes the lenses a little more sturdy. And I'm trying to remember if it's just breakage or scratching too, because I think there's a scratch filter as well. But know that the polycarbonate is, it's a good option. I know I have it. I forget all the wonderful benefits as to why. I think it makes my glasses lighter too, just to, I got lenses. But anyway, these are enhancements. You'll see the rates when you get your packet in the letter that has there. For those of you who are on the signature plan, I wasn't able to get the system to add another line to show choice. So if you're looking at it, you'll see signature, your current year price, and then next to it, it'll have next year's price, but it won't be the signature plan, it'll be the choice. I know that may be a little bit confusing, so that's why I'm kind of mentioning it now. All right, moving right along. We did have some changes in our rates. So these are the non-Medicare rates. Anthem, luckily for us, we didn't have a significant increase. So for those of you that have not yet hit Medicare age and are on our Anthem plans, there's a 2% increase this year for the HMO plans and only a 0.29% increase to the PPO plans. Kaiser unfortunately experienced a little bit more. Kaiser rates are up 10.63%, but the good news is with the subsidy, it still winds up being affordable. So we'll get into that when you hit the rate sheets. And the rate sheets, by the way, are currently posted on the Open Enrollment website. And I believe Tram has a few of them here today with her. Hopefully Ray introduced Tram. Tram is one of my analysts on the team. She answers a lot of the calls when you call in asking questions. She'll be here with me after the meeting concludes to answer whatever you may still have pending. All right, so Hawaii and Northwest, they went up a little bit, but I don't think anyone in this room is there, but maybe out on Zoom. Hawaii, you have a 6.12% increase, and the Pacific Northwest is looking at 14.5%. Now comes the shock. Okay, everybody take a minute to breathe this in because I know you see that number there on Anthem. Let me tell you, this number came in as a shock to all of us too. We had numerous conversations with our Anthem leadership team, Medicare specifically, and we had their leadership team on the call to really try and wrap our brains around what on earth influenced a 34% 0.85% increase to our Medicare rates. Again, take a moment to kind of breathe that number in because I'm still having difficulty saying it. It was a rough negotiation year for us. I will go into detail as to what influenced that in the next couple slides because I'm going to give you behind the scenes with what was shared to us because I feel that you really do need to have an understanding as to why that rate is so high. We did have some of those influencers on our Kaiser Medicare rate as well. California rates went up by 12.83%. Hawaii went down a little bit, but I know that they had been fluctuating, so they had increases, and I guess this is leveling off. I never really kind of picked into it because I went, okay, it went down, great. And our Pacific Northwest is going up by 6.47. So I have a note on here about the Medicare rates increasing due to funding. As we know, again, medical's in the news right now. The good news is all of this is locked in for 2026. So even as Medicare is having fluctuations in funding, the carrier, which is Anthem, has to take on those additional costs. So again, kind of thinking about that and looking at that 35, we'll call it % increase, that's factored in. Okay, so for this last rating period, what they do is they look at a period in time of the utilization and our plan utilization, along with all these other factors like CMS funding, et cetera, drive what rates they offer us the next year. So this is one of the pieces of material that was presented to us from the Anthem leadership, and I think it's really important for us to kind of pick this apart a little bit. So if you look at the left-hand side of this slide, the total PMPM, which is per member per month spend on Anthem services, went up 15.7%. You're like, well, that's not 35%. Yeah, it's true. It's not 35%, but it is an increase, and we look at that in pharmacy and others. But what I want to call your attention to is the smaller print that somewhat visible in the back of the room, maybe. The HCC is high cost claim. Okay. We had an uptick in high cost claims in the amount of a 28.4% increase. Those high cost claims, and I know we don't like to get into medical conditions and all those things, but I'm just going to lay this out here because you can see on the right-hand side, there's the circulatory, the cancer, the musculoskeletal. We had a significant increase in our members seeking cancer treatment. Our cancer treatment rates, with what we're doing for our members to make sure that you get the services you need, remain as healthy as you possibly can be, the cancer treatment rates really factored into those high cost claims. And it is what it is. I mean, we can't really do anything. We're not denying anybody services. That's not why you pay for medical. You go in, you use your services. But what happens again is we have these fluctuations of the high cost claims and the amount that Anthem has to pay for these services. And at this time, that is getting really close to, if not ticking over, the amount that we're paying Anthem in premiums. So if we're paying them, say, I'm just going to round up a number, make up one, $3 million a year in our premiums, and they're spending $5 million a year on our services, they're not going to want to keep carrying us because we cost them money. So they have to kind of find that balance. And that's literally where we are right now. We're on that cusp of them spending more than we're paying them. So that factored into that significant increase. I do want to pull up, just your eyes again to the circulatory cancer and musculoskeletal. If you look at that, you can see the increases. The green is last year, the blue is current rating period, and the white is the benchmark, which is the nationwide benchmark as to where the spend is for those types of services. And you'll see we exceeded every category. So as much as I choked down that 35% increase, not because I have to pay it, but because, I really want you to have affordable health care. That's what we're here for. We're helping you. That's the whole point of my team, is to make sure you have what you need in your retirement. That was a huge factor that we focused on for countless weeks to try and bring down. It's just something that we couldn't do. So we're going to transition into a new day of Medicare coverage, and I'll kind of get it in front of you in just a moment in our next slide. Any questions so far from the floor? I know we said hold till the end, but I know this is a lot. Okay, we are here to answer questions, so please, reach out to us with anything that you've got. I will move along. All right, so what does this mean to you? For those of you that are currently on this Medicare PPO plan through Anthem, you should have received a letter as mentioned. In the letter, I also included a rate sheet so that it showed you where you are today, where things are going in 2026, and the breakdown. I think I just focused again on member and member plus spouse. That's the majority of how we have people enrolled. There are some of us that have, younger dependents or younger spouses that are still on a commercial plan. So those rates are going to fluctuate depending upon what your enrollment level is. But for today's purpose, we're just going to focus on member and member spouse. Okay. So our current plan that we're offering right now, that premium with that increase came in at $738.58. If you remember me talking about the high deductible plan that has the maximums that people needed to reach, that was a $3,400, $1,700. That high deductible plan is the benchmark that we use to subsidize the amount the fund pays for you for your medical coverage. So up till today, it's been zero out of pocket for Medicare. So if everybody in your family is on Medicare, you, your spouse, whoever else you're covering, if they happen to be on Medicare, would have been a zero out of pocket. But because that monthly premium is now exceeding the amount that we subsidize, which is the $705.54, that leaves you with $33.04 per month as a premium that you will now be paying to stay on this exact same plan. So again, the MMPO, again, Managing Medical Plan Options, I think is what that stands for. I just always call it MMPO. We looked at this and we said, okay, well, what can we do? Is there anything that we could do to try and bring this price down? Because this is pretty significant and our members, some of them may not be able to take on these monthly premiums. What can we do to bring this price down? So we looked at potentially mimicking the Kaiser plan. Well, our Kaiser Medicare members are paying $25 every time they go to the doctor, and they have other copays that they pay for the different services, and that's what we reference as a plan design. So their plan design, they pay more out of pocket to get those services. Our Anthem is pretty awesome. To date, it's been zero. So the only time that you have to pay is if you have prescription medication. So you go to the emergency room, you go to your doctor, all those things have been a zero copay. So what can we look at that is a factor in what we're seeing with these increases that we can add to another plan to try and bring the cost down a little bit? Well, one of the things that Anthem brought to our attention is we have a lot of members that are using the emergency room for non-emergent visits. So I'm feeling a little dizzy. Instead of calling the advice nurse, I'm going to the emergency room. Now, granted, if it's an emergency, we are not telling you don't go to the emergency room. You absolutely do need to seek emergency services. But if things are not what they reference as life or limb threatening, non-emergent, you should be calling advice. You should be going to your primary care. But if, again, you feel the need to go to the emergency room, I'm not going to tell you not to go. But we did have a significant number of emergency visits that were non-emergent. That also factors into what we get in rates. So taking that into consideration, we said, okay, well, what happens if we put a copay that's essentially the equivalent to the Kaiser plan on a new plan that is just a $75 copay? If you're going to the emergency room, you're not admitted to the hospital. Every time you visit, you pay $75. What would that plan look like? Well, if you look, that premium is now going to be $711.34. And again, I'm focused on the member only. And we subsidize the $705.54 based on that lowest cost plan. So that brings the $33.04 that you would be paying for the plan you're enrolled in today down to $5.80 a month. It's a little bit more palatable. What that equates to is a savings of $326.88 a year, or the equivalent of 4.4 emergency room visits. So if you're not one that goes to the emergency room in lieu of trying to seek services elsewhere, again, life, limb threatening, please go to the emergency room. This plan may be more interesting to you because it's going to be a lesser out-of-pocket expense for you. These changes, absolutely 100%, you will be submitting an open enrollment form for. This will not automatically roll over. I'm not going to move you into this plan unless you want to move to this plan. But again, it will save you money. And if you legitimately need the emergency room and you're not admitted to the hospital, you pay the $75. You're still saving money if you don't go more than 4.4 times a year. So this is a cost saving in this yuck, if you will, of a Medicare conundrum that we're in with regards to the increases. So hopefully this will resolve some of our concerns with regards to the increases, and then whatever we can, get out of the RFP for next year, we're still looking at trying to make things more affordable nationwide, because for those of you who are in the Anthem plan, typically it's because you're outside of a Kaiser service area. That is a challenge. If you're outside a Kaiser service area, you don't have another option. You're kind of stuck with this because Medicare is a requirement post 65. So for anyone that happens to be in this room today and lives within a Kaiser service area, because you're here in California, and for my friends here on Zoom, we are more than happy to check to see if you're in a Kaiser service area, because I actually did the math, didn't bring it with me today, but because again, I was doing a lot of studies to try and figure out what can we do to mitigate this high increase. I did find there are quite a few members that are within Kaiser service areas, but they elect to be on Anthem, and that is a personal choice. Some people don't like Kaiser. But now looking at this, you're kind of like, oh, this is kind of expensive. And here's where it hits you again, and I'm going to tap dance into this very, very lightly, because I know this is another plan and an expense or a premium program that you all enjoy. It's our Med B reimbursements. If you're in a Kaiser service area, as you can see in yellow, any of these Medicare plans that you're in, the column on the right-hand side is the difference between the subsidy, which is at $705, and the total premium that Kaiser is charging us for your coverage. So for anyone who's enrolled in Kaiser, you can see you still have some money in between what that subsidy is and what the premium is that gets put in a bank that you get for your Medicare reimbursement. So for Kaiser members, you still will be able to, for 2027, file for 27 for the funds paid in 26. This is really what's going to be affected. You'll still be able to submit for those. For our members that have no other option and stay enrolled in Anthem, unfortunately, all the money is spent. So you'll see the premiums, unfortunately, are exceeding that of the subsidy, which is again why you have an out-of-pocket copayment of $33.04 if you do nothing, or $5.80 per month, again, per month, if you move to the $75 copay plan. Okay. I know it's a bit of a culture shift, and this is something that we've been really trying to mitigate as best as we possibly can, but we're very much available to you to discuss your options. If you think you're in a Kaiser service area and you're considering changing and you're getting lost trying to navigate the zip codes on the website, just call the health team, call the retirement services office, ask for a member of the health team. We will step you through all of this. We all know exactly what's going on. We know how to navigate this, and we will do our best to help you come up with the best option for you and your family. All right, any questions on this one? This is the big bomb of the day, so. All right, moving along.
Teresa,
Yes.
Just for a second.
Yes,
Yes.
I'm gonna step aside.
Careful. Oh, careful. Okay. So let's understand what she just talked about here. The SRBR reimbursement for the Medicare Part B, it's not being taken away from us. It's still available. And should next year rates crash down or if they have to raise the rate for the lowest cost plan, then the Anthem people, you may be available to get SRBR money. So I want you to know that the SRBR is in contract. It's set in stone. It's there all the time. So we're not losing anything. It's just because of the way the prices have gone, the availability for those of you on Anthem has gone away. So I want to make sure that everybody knows nothing's being taken away from you. The city hasn't done anything to you. the association and the local are staying with you all the way, but for this year, because of the price of the lowest cost plan, there is no room for that reimbursement for the Anthem people, okay? Anybody have a question about that? I'll take that question right now because some people said, oh, they're taking something from me. No, boys and girls, they're not. It's just that that's the way the finances are going, okay? All right. There you go.
And the good news, if there is any good news in this, which should be the obvious news, is all the money that you paid in 2025 is in the 2025 program. So I will still be sending those letters out in January, allowing for people who are on Anthem to get their 2025 money back. So this is for people who are going to be filing in 2027 for 2026 funds. I'm going to keep my fingers crossed that this changes. I mean, we don't want to see these rates above affordability. We want you to have the best benefit, but this is the circumstances that we're facing today and what we've done to try and help mitigate them. Okay. Like I said, this is my big thing. Ray's got something here for me. I'm not sure. Are we got time?
One slide that's
Back up, sure.
Member and spouse. I didn't look at that. So
Okay, yeah. So the member and spouse, if you look at it and you do math in your head really quick still, it's exactly double. So if you have 2 people on Medicare, 3 people on Medicare, it's literally double, triple. That's the way that works. Where it gets more complicated is if you have someone that is not of Medicare age, and we have you in what we reference as a split plan. The split plans, those get messy. There's all sorts of formulas, and there's no way I'm doing that math off my top of my head. I have an Excel sheet for that. So if you're on a split plan and you want to know how this affects you for that, Tram has some rate sheets with her today. We can kind of go through that before you leave. For those of you online, they are currently posted on the Open Enrollment website. Okay. All right, so I'm going to move along. We'll go past doom and gloom to the wonderful news that, as you already know, once we hit age 65, we have to enroll in Medicare. So there's really no escaping this whole Medicare conundrum. At age 65, hopefully you would already have received a packet from our office. When you get about 3 months before your 65th birthday month, we put together a packet of information. It can be extremely confusing. It could be, helpful. But we also offer workshops. So I think there's a workshop next week. And there's also going to be 2 condensed versions at our health fair. So I'm really encouraging people to come visit us at our health fair. We love seeing your faces because I only get to see you, 2 times a year maybe. So please do come out to the health fair. I will be running around like a chicken with my head cut off, but making sure that I say hello to people that I know and anybody that comes up and asks a question. So at age 65, we have to enroll in Medicare. There are 2 parts to Medicare that are critical, A and B. A, if you have paid into Social Security, usually kind of takes care of itself. We have paid into, or have a program, I should say, with the city that allows us to get A for free, unless you're a pre-86 hire. So for those of you that still have not yet retired or have retired and you were a pre-86 hire and you're not yet on Medicare, it gets a little trickier, but we do have B-only plans for some of our areas. But the bottom line is you have to pay for B. So that's one of the reasons why we subsidize so much of the Medicare premiums, is so that the money that you would have paid us for your health care is actually getting paid to the federal government for your Medicare Part B component, which is why we have the reimbursement program, which you guys are luckily the only association that gets to take advantage of, which is a good thing for you. All right, so the whole point in bringing this up is, unfortunately, we still see today members that forget to pay their bills, members that don't think that they need it. Medicare tells them, oh, okay, well, you didn't pay an A, don't have enough credit, so you don't qualify for Medicare. Everyone qualifies for Part B. B is paid for out of pocket. It's not subsidized. It's not a for free thing. It's not a service credit thing. It is a paid for thing. So I just want to reiterate to everyone that if you get a letter from Medicare because you're a pre-86 hire that says you don't qualify for Medicare, it's just because you don't have the service credits for A. Everybody has to pay for B. And so we do have members, unfortunately, as I was mentioning, paying your bills and all that kind of stuff, that have lost their B for whatever reason. Again, maybe they had it on auto pay, bank hiccup, whatever. The minute that you lose your B coverage because of whatever reason, you get dropped from your retirement services medical plan. You lose your entitlements, Medicare hiccups, you get disenrolled from Kaiser or Anthem. So it's really, really critical for you to understand that that Medicare Part B, it is a big deal. It's more than just the reimbursement. It's still making sure that you have the ability to go see your doctors, because that's what the Medicare Part B funds. Medicare A is dealing with hospitalization, B is for your doctors. Complicated stuff, which is again why, if you want to attend our workshop, happy to have you there. You need a refresher, please, again, plugging my health fair, please come to the health fair. So as I mentioned, and you can see up here, loss of Medicare, loss of coverage. I really, really want to avoid that. Those are some awful phone calls that we have to make to people. We don't like them. You don't like them. So please just make sure you've got everything in place that your Medicare Part B gets paid for. We don't want to interrupt your coverage. The last thing that I'll mention about Medicare is we get so many calls about this, and I know you're living it. I went to Walmart and I got this flyer and it says that blah, blah, blah. Okay, Medicare, Medigap, supplemental, any of these things that anybody approaches you through a mailer, through Walmart, through wherever you're going, don't respond to it. If you're getting it from Walmart or you're getting it in the mailer, throw it in the trash. If you have any question about its validity and what it's going to do to your coverage, if you've forgotten what I said today, don't forget this part. Call the office if you're not sure. Because what's happening is somebody's going to say, ooh, you can have this Medigap plan and it's going to cover your dental. Well, you've got Delta Dental through us. Should have been free when you retired. If you qualified, not deferred, vested, qualifying that. But if you enroll in any of these supplemental or Medigap plans, Medicare takes all of the money that they pay to your plan administrator, which would be Kaiser or Anthem, and they move it to this new company. So what does that do to you? It disenrolls you from our plan. So that's another way that we have lost members. We get reports and we're like, well, what happened to this person? We call that person and they go, I don't know what happened. What's going on? Why'd you drop me from the plan? Dig a little deeper, come to find out, some person at Walmart's trying to hit their quota and they're sending home information. Somebody goes, ooh, cool, I can save on prescription drugs. You have a prescription drug program with supplemental plans here because we have Advantage plans. So our Advantage plans include all parts of Medicare. Will one of these cover maybe, $5 more at the dentist? Potentially. You may get a little bit better stuff from what it is that they're selling. However, if you move to that, now all you have is that. So if it's a dental supplement or a vision supplement, you've lost everything else. But you could use classic Medicare as a Band-Aid until we get you back on our plan. So all of that to say, if you see a flyer, throw it away. If somebody asks you, hey, do you want it? No, I don't. Thank you. I'm covered. I have my Advantage plan. If you hate our plans, that's another story. Call us. We'll talk to you. We'll try and figure out what your options are. But please don't respond to these supplemental offers. Okay, wrapping up, getting close to the end. Both carriers, Kaiser and Anthem, they have apps for various things. You can make your appointments with your app. You can check your lab results. You can do various things with them. Kaiser specifically is what I kind of have up here, has some additional apps that are available to you at no cost. We have Calm, Ginger, this My Strength. Each of them have a different focus, and it has to do with wellness, syncing mental health services, and things of that nature. Download them. They're free. If you want to just kind of find, ocean crashing waves to help lull you to sleep, that's in the Calm app. Apparently there's some talk where Matthew McConaughey will talk to you until you fall asleep. If you really like Matthew McConaughey's voice, download the Calm app. But what I'm saying is there are apps that are available to you. Please use them. There are flyers on our website that kind of go into detail about what these things are. They're available, and we're happy to share whatever information we may have on them, but I want to bring them to your attention. All right, some of the things that are still continuing with our Medicare is the Anthem Silver Sneakers and Kaiser One Pass. Those are both of our gym programs, if you will. Kaiser always has these wonderful things, and I'm sure Anthem has things that I'm not highlighting. I highlight every year that if you're put in a rehabilitation facility or you've been hospitalized and you need assistance with meals, Kaiser has a 3 meals per day plan that goes up to a total of 84 meals. And they also offer transportation. So annually 24 trips to and from your doctor if you can't drive yourself. So if Uber family member isn't an option, this is an option. If you find yourself needing this or potentially needing this, I strongly suggest you look up the flyer on our website or just call the health team. Get that number plugged into your phone so that it's available before you need it. Okay. Here's some various resources. If you'd like to take out your smartphone now, you can take a picture of the screen. But our open enrollment website is going to be the one that's going to be most important to you, at least until November 30th. You can get forms, you can find rates, you can set up attending a webinar or a personal appointment with Kaiser or Anthem. Right now, that's pretty much what I have posted. There are some things that are still coming in from our carriers, which is why things are a little delayed this year. Last year I was ahead of the game. I'm kind of frustrated we're behind it this year, but we're rolling with it. The summary of benefits, which is that large, huge document and evidence of coverage that we post on there, that are like pages and pages and pages that define if you do this, then it's that kind of a thing that digs into the details of your plan. Those are still outstanding from our carriers, and we will get them posted as soon as possible. I always have them on the open enrollment site, but unfortunately, since they're not available right now, what is available is the home screen. We put the rates at the bottom. And then we have key details on things like our health fair, and I believe the webinar and appointments are currently live. Tram is working very, very diligently as we get everything in from the carriers to get them posted. My hope is within the next week or so to have it completely built and live, but definitely by November 1st, because they have to have that information to me. But you know how it is when you're at the mercy of others for information. I post as quickly as I possibly can. Moving along, if anybody has any issues with claims, these are the various numbers. You can take a picture today or visit our website because those numbers are there too. If you are having difficulty with coverage, claims, just seeing a doctor, know that you have advocates for both carriers. If you're having challenges and you're getting frustrated and you're spinning your wheels and you're not getting the help that you need when you're trying to reach out to Anthem or Kaiser on your own, call the health team. We're here to help you. Any member of the team that picks up the phone, we can reach out. We have an advocate for both carriers. They will insert themselves. Even back when we had the Anthem HMO days for the Medicare, where people are saying, we can't find a doctor. They stepped in and said, hey, dummy, you've got a contract. You need to honor this. So they're there. They're available. You don't need to navigate this stuff on your own. So please do know that our team is here to support you. All right. With that, a lot of information to take in today, I understand, and I really wish I had better news and more fun news for everyone. I will take any questions that you have.
Yeah, if you can.
It's corded. It won't go that far, unfortunately. I think they want it to go through the mic, but I mean, I'm happy to repeat it if we need to, but let me start with this gentleman here.
That's kind of a general question. You stated earlier that if you're happy with what you got, you don't really need to do anything. The 35% increase will come out. That's what we will be paying in addition to what we're being taken out now. Will that automatically come out of our paycheck? Do we need to sign another paycheck thing or with retirement services to get that transferred over, or is that automatic?
Okay, fantastic question. All right, I'm going to answer this in a couple layers. Do I need to do anything if I don't want to make changes? This is my $1 million question every year. Please do not submit a form to me if you're not making changes. And the reason why I say this is every year, inevitably, we get about 100 forms or more that we go through because we're not going to go, oh, okay, there's no changes. No, we literally go into your account and we look at every enrollment, every dependent listed to make sure there's truly no changes because we want to make sure we don't miss something. So if you're not making a change, selfishly, I'm asking you, please don't submit a form. Now, if you are legitimately making a change, whether that's adding an adult child that is still able to be coverage, dropping a spouse because they've got coverage elsewhere, or you're going to in lieu because now you have coverage through your spouse elsewhere, any of these changes that truly need to be made within the system, absolutely 100%, you are sending me a form. With this Anthem plan thing, right? Where the Anthem Medicare plan that you're currently on, that PPO plan, that's going to be that $33 a month that I shared. If you do nothing, you will be on that plan still. We're not changing that plan. That plan is what it is. It's just the cost goes up. So that'll now cost you the $33 and some change per month. How is that taken out? As you suggested, and is absolutely accurate, through your pension check. So now what you will see, what you haven't seen in the past, is a deduction. It'll show your insurance stuff broken out. So if you currently see the deduction for dental or vision, actually it wouldn't be dental, but for vision, whatever the reductions are on your check stub, it will be listed there with the amount, and that will be monthly. So those changes, definitely, you want to send me a form if you want to go from what you have today to save money and go to that $75 emergency room copay plan. So that would absolutely be a form. The other thing that's absolutely a form is the Health in Lieu program. So for those of you that are on Health in Lieu, you hopefully already know it's a credit program. It is not a cash program, and the premiums, well, the money that is put into, now I say money, but the credits that are put into a bank for you are only applicable to premiums. So if you now need medical coverage and you've got this bank of in lieu money, it can now be applied to those premiums. For some of you that rolled into Medicare and you haven't had to pay anything out of pocket, you may still have a pot of money sitting there if you ever participated in lieu. That will then pay for these premiums, and you'll see that on your paycheck. So you won't see the actual deduction because your in lieu credits can then take care of that. So we need to make sure that you have that available to you. So if you think you have in lieu and you want to handwrite, check my in lieu on your form before you submit it. I'd love it because I want to make sure that everybody gets the benefits that they're entitled to. But again, with in lieu, because of the way that the Muni Code is written, you need to submit a form every year to re-enroll in those programs. So if you're using dental or health in lieu because you've got coverage elsewhere, you want to submit a form to me. If you don't submit a form to me, you will not be re-enrolled, and then you're not going to get those credits. I inevitably get calls every year, I'm not going to say every week, but frequently enough, that really are, again, hard to manage, just because people are not happy when they find out that they've lost those credits. ORS has not yet to date and will not retroactively credit those back. So if you were traveling and having fun skiing the Alps or whatever it is that you do during open enrollment, you forgot to submit that form, you come back home, it's now March. Oops. Yeah, oops, I'm sorry. I really wish I could give you those credits, but we just can't. That's part of the way that the program is written. So you do need to make sure that you submit those forms to us. So it's critical that you get those forms in. But again, if there's no other changes, unless you're on in lieu, you don't need to submit a form. So hopefully that is a long-winded answer to your question.
Justin has some questions from online.
Yes, go ahead.
Okay, I'm gonna try to combo three of them together. For the Anthem 75 program, is a trip to the urgent care clinic the same as a trip to the emergency room? And clarification, the new Anthem $75 plan, does it only affect ER room, no other changes in our benefits?
Okay, so I'll start with the last one. The $75 copay plan, the only change is the $75 copay when you go to the emergency room. Everything else in the plan design is identical. So you will not pay to go see the doctor. That $75 is waived if you're admitted to the hospital. So do note that as well. So if you go in, it's life or limb threatening, they admit you into that hospital, you're getting the $75 back. But that is the only copay other than having to pay for your prescription drug coverage. Now going to the question before that, trying to remember all of the parts of that.
Just is urgent care the same as
Urgent care,
ER?
thank you. Yes, urgent care is one of the ones that keeps coming up. Urgent care is treated differently than emergency. Urgent care is kind of that level in between going to see your doctor and, oh my God, I need help now. My understanding is that, like your doctor visit, that isn't changing. It's only if you go to a hospital emergency room that you have that copay. So you should not see any copays for urgent care, only the $75 for the emergency room.
Any other questions? Any other questions?
Do we have more online? I have this gentleman back here and then we have more online.
No,
Oh, you're good now? Okay.
go ahead.
What do you got there, buddy?
Yeah.
And I do
I'm just gonna-
appreciate everybody sitting through this. I know we're a little over your normal time, so.
Yeah, I'm just gonna try to read it because it's a little complicated.
Okay.
Anthem out-of-network providers, they are paid only the Medicare CMS amount for the service. Then for out-of-network, i.e. out-of-state and area, Anthem doesn't pay a thing from Anthem, just the Medicare amount. Is that correct?
There's no difference. That's a complicated question. Okay.
I told you.
Yeah, that is okay. So I don't know what the foundation for this question is. If it's an individual circumstance, and if that's the case, if I'm not fully answering your question online, please call the office and we can step you through this. But the CMS funding that goes to anyone that offers Medicare services is the CMS funding, right? So the federal government gives them a pot of money. Here you go, administer these plans. Anything above and beyond those costs are incurred by the carrier that are then billed to their clients. So you've got this pot of money that CMS gives you, so that covers part of it. Then you got this pot of money that we'll just say City of San Jose has paid for our retirees to cover you with your insurance. So those two pots are then combined into what's covering, your medical stuff. If the CMS funding isn't covering everything, which it's supposed to cover some of this Medicare stuff, right? They go to the premiums that we pay, and that's kind of where this all balances. And we were talking about the high cost claims and all that stuff earlier. So I don't know, again, the specifics for that question. It's a little, there may be more there than what I'm able to ascertain through just hearing the question. So I strongly encourage, unless there's multiple people out there that are asking this, please call the office so that we can figure out what the circumstances are regarding whether you're having a hiccup with coverage, something's going on with you specifically. We would like to address that individually. But, note that you've got, again, different buckets of money that covers your medical stuff.
For some of you, the idea is when you go to the doctor or you're going someplace, ask the question, are you accepting my Anthem insurance? That will tell you whether they're in network or not. You ask that question, then you'll know right off the bat. Because you may incur more of a cost if they're out of network. That's probably quite true based on what we know. But that's something you need to ask before you get your service, before you're laying in there on the bed and they're doing stuff to you. You might want to ask that question. Okay.
Yeah, and I think if I start digging into this a little bit more, there are circumstances where there's the doctor or hospital bills Anthem directly, or they bill you and make you get reimbursed. So in those circumstances, if it is what they call out of network, their rates may be higher. So if they're charging $1,000 and Anthem only pays $20, now you're on the hook for that $1,800. So those are the cases where you just do need to be careful when you're out of network. That's the thing that's nice about the PPO. You can go seek services outside of network. You're not restricted to it. But if you're in network, all of the prices for those visits, for the Kleenex that they charge $75 for at the hospital, all that's negotiated, and it's included when the carrier Anthem pays the bill.
One of the ways we see this happen is that, especially with anesthesiologists.
Yes.
That seems to be a real problem, is the fact that a lot of them are not in a network, and so they charge whatever they want. So when you go, if you're going to go have an operation or something, tell the doctor or whoever's doing it, I want my anesthesiologist to be in network. I want covered under my insurance. That's the thing you need to look at.
Just check.
That's most of the time. That's where I hear the problem is with the anesthesiologist. So, thanks. Anything else there?
Not for me. Any more questions?
More questions? You can tell them we're gonna send out the video and the presentation.
Okay.
Jim?
So just a note to everyone, that the video and the presentation will be sent out after the meeting.
Okay, how about a big round of applause for Teresa?
Thank you, everyone. Yep.
We have the rate sheet. So you wanna stop by and pick them up, there is a hard copy right there, otherwise you can't get them online
All right,
at the
thank
retirement
you.
services, website, okay? All right, folks, have a good day.
Wait. One more thing. And this will not pertain to anyone in this room because we're all over 65. But if you have a spouse that's under 65 and isn't Medicare yet, but it's going to be, that window that you have 2 months before, 2 months after to sign up for Medicare is critical. Because if you don't sign up, there's a penalty. And that penalty is for the rest of your life. It doesn't go away after a year. It doesn't go away after 2 years. You pay this penalty, it's for the rest of your life. So understand that. Make sure if you have somebody that's, oh wait, are you under 65, Tim? Wow, it actually pertains to somebody here. Make sure you hit that window. That penalty is substantial. And you just don't want to get hit with it.
To kind of tag on to that, that is 3 months after your 65th birthday. So you have 3 months before your 61st birthday, your birthday month, and then 3 months after. If you don't enroll in Medicare in that time frame, you have to wait until open enrollment for Medicare, not ours, Medicare's, which means you're without coverage. And if you're without coverage, you're going to also incur a penalty for not enrolling in time, which is what Ray said. So follow the instructions we send you and ask us questions because that's what we're here for.
Stop round filing things. Read it. Thank you, Teresa.
Absolutely.
Much appreciated every year.